How do you fund healthcare if you're going to retire early? That's the topic of today's video, and we're going to cover everything that you need to know to make your early retirement a successful one. Welcome back everyone to the channel. If this is your first time here, I specialize in helping school district employees in Washington State build better financial lives. Make sure you hit that subscribe button down below to join the community. So when it comes to funding healthcare for an early retirement, you have a few options, and it may depend on which pension plan you're on. So you want to be pretty clear on if you're plan 2 or plan 3, as some of these will apply and some won't. But before we look at how we're going to pay for it all, let's look at what medical options we have available. So the first one I'll talk to you about is COBRA. So COBRA is basically 18 months of continuous coverage through your employer. So once you separate service, you have the ability to use COBRA. Now, costs on COBRA are typically going to be higher than what you're used to paying before because your employer is not paying for it anymore. You're paying for it out of pocket. You're just kind of utilizing their plan to kind of keep their same benefits. Now, COBRA typically is meant for people who separate service prior to being retired. So usually in between job changes or if someone got laid off or fired, that's what COBRA is really designed for. It can be used as a bridge for your retirement. However, it may not always be the best bet. So before electing to choose COBRA, you want to look at some of these other options that I'm going to go over later in this video and compare costs and see what's going to make the most sense. Now, one of the best options out there is the PEBB medical benefit plan. And PEBB is the Public Employees Benefits Board. Essentially, it's only for public employees, so costs are usually a little bit more competitive than what you could find in the private market. And I've heard nothing but good things about PEBB since I've been in the business. So you're eligible to enroll in PEBB once you retire from your school district. If you're on plan 3, you can just move straight into PEBB without even collecting your retirement benefit first. Now, if you're retiring early and you're on plan 2, you're required to start taking your pension payment before you're eligible to be on PEBB. And chances are, if you're retiring early on plan 2, you're not going to be taking your pension plans because you don't want to take the reduced benefit. Therefore, you're not going to be eligible for PEBB yet. So in that case, COBRA is going to probably be your best bet, and it's going to give you 18 months closer to hitting age 65 where you can get onto Medicare. Other options you have is if you have a spouse, of course you can try and get into their plan, but you want to look at costs. Sometimes it may be too costly with their employer to add you onto it, and sometimes it's not. So something to look into as well. And then of course you always have the fallback of the private market. So you can go out there and just buy your own health care. Depending on what your income is at the time, you may qualify for reduced premiums. You can just use a site like Washington Health Plan Finder to kind of shop around coverages. Now, how do I actually pay for medical if I'm retiring early? Well, you have 3 ways to do it. Option number 1, you can go ahead and get yourself a job, whether it be full-time or part-time, and use the income from that to pay for your medical insurance. Now, it can be as simple as either substituting a few days a week at the school district. Maybe you want to start your own business. And really all you want to do in this is just make enough money to pay for your medical insurance. So if you need $700 a month, can you think of anything out there that you can do and enjoy more than what you currently do and make $700 a month at least? You probably could. So that's one way to look at it. The second way to go about paying for it is to find an employer that's going to pay for your medical benefits. That's probably the easiest solution. And there's a couple places that can do that for you. I know places like Starbucks, Home Depot, or even Walmart will actually pay for healthcare, or at least a majority of it, for their part-time workers. So it's not a bad trade. You can work part-time, have your medical costs reduced, and still earn a little bit of side income. And option number 3, if you're wanting to pay for your medical insurance and you do not want to do any more work, not full-time, not part-time, you just want to be done so you can enjoy your retirement, then you just have to pony up and front the money. And that can come either from your Social Security income if you're trying to draw on that, or it's going to have to come from your savings or a retirement account. Now, some people get kind of scared of pulling money off their retirement account to pay for healthcare because it's a big cost, and it is. However, keep in mind that it is just a short-term draw. If you're retiring only 2 years early, then you're only drawing on this for 2 years. So it's something you want to look at definitely before you pull the trigger on early retirement, but it's not the end of the world. And in many cases, it actually is not as bad as you think it may be. Because once you're age 65, healthcare costs go down. Once you're on Medicare, your full pension is going to turn on. Maybe you'll turn Social Security on that time. So your income is definitely going to change later on, and you may not have to draw down any of your retirement accounts at all, and they can recover over time in the market. So if you're wanting to retire early, make sure you check out these videos over here before you do so, and I'll see you guys next week. Remember that your future depends on what you do today.